Hi, I'm Dr. Taylor Pascal with Pascal Chiropractic in San Jose. And in this video, we're going to talk about ice versus heat versus topical creams, sprays, and patches. It's a question that we get often in the office. Doc, which one should I use and when? So we're going to hit on all those. So ice essentially is going to slow the pain signals from the tissue that's carried upon the nerve to our brain so that either that signal isn't received or it's less. Ice also reduces the body's inflammatory process. While that's a good thing short term, the caveat to that is that the inflammatory process is actually how the body repairs itself. This is how it heals. When we have an injury, there are chemicals released that bring inflammatory cells to that site of injury. Now their job is, in addition to recruiting more inflammatory cells to that area, is to eat up all the damaged tissue, clear it away, start laying down some scar tissue, make way for cell repair. It's important to keep that in mind, that we are ultimately going to potentially slow down the ultimate healing of that injury. So how do we use this information in the real world? Now, if we're an athlete and we're in the middle of a season and we sprain our ankle, we do not have time to wait for that body to go through the full inflammatory repair process. We need to get back on the field, right? Back on the court, whatever our sport is. So it's good to use ice to stop that inflammation. You stabilize that injury as best you can, and you do your rehab and get back to the field. Now, if we're not in season, a lot of times my recommendation to the athletes that we work with is let's lay off the ice unless we really need it for the pain and let the body go through that healing process as it's naturally designed to do. When we're talking about heat, a great benefit of heat is that it helps relax muscles. In many cases, the muscles might not be the injury itself, but a lot of times muscles overwork to try to stabilize or compensate for an injury we have, and those muscles that are overworking end up being what's causing us pain. So applying heat is a great way to relax some of those muscles and get us some relief. Of course, with that increased heat, we get increased blood flow. That could potentially increase that inflammatory process, so we want to keep that in mind if we have an acute or an inflammatory injury. Now, depending on the phase of care that we're in, I might recommend that we use ice or heat or alternate the two of them, and that's going to come down to an individual basis, okay? So make sure that you do your homework or you consult your health professional. Now, when we're talking about topical pain solutions, whether that be Salonpas patches or BioFreeze or Icy Hot, what that does is kind of simulate ice and heat. It gives the nerves that sensation, that feeling of a temperature change, but it's not actually applying cold or heat, right? So since the temperature signals travel faster along nerves to get to the brain than do pain signals because they travel on smaller, slower nerves, that temperature information gets to the brain first, essentially overriding that pain signal. They call that the pain gate theory. Now, it's important to keep in mind with all three of these, ice, heat, and topical pain solutions, that all of these are very superficial. That means they do not penetrate very far into the body's tissues. So in that regard, there is some limited application. Most importantly, all three of these are only going to address the pain. They're only going to address the symptom. Now, in most cases, symptoms are our body telling us that something is going wrong. And I encourage us to listen to those and understand it before we start using things like these that are going to numb the pain, numb our perception of the damage that's going on in the body. Now, all three of these, ice, heat, and topical solutions, are going to address symptoms, which means they are not going to address the root cause of what's going on in the body to cause the symptoms. So they're not going to improve our body's ability to recover if we haven't addressed that underlying issue as well. Think about topical pain creams, ice and heat, like this. I'll use my Homer Simpson reference. So Homer Simpson's sitting in the nuclear reactor, and a meltdown begins and the sirens go off, it's wailing, and everybody's freaking out, right? So Homer Simpson turns off the alarm. Well, our ears feel better, but that meltdown is still happening. Now we just don't have the awareness of it. Symptoms are much like that alarm going off when the reactor is melting down. Yes, and it's an extreme example, but pain is our body's way of telling us that something isn't right. If all we do is cover up the symptoms, then we've missed that signal from our body that we might need to be more careful with this injured area, that we might need to protect it. These topical approaches with ice, heat, and cold are going to enhance our ability to push through that pain and get done what we need to get done. But in the long term, not listening to that body's pain signal could potentially lead to wear and tear at a faster rate than if we had just addressed that original cause, and then we wouldn't need to depend on the pain relief solutions in the first place. Because when we address the root cause of what is causing a symptom to present itself, and that is resolved, then there's no longer a need for the symptom. So the body handles that itself the way the self-healing human body was designed to do. I hope that answers any questions you had about using cold, heat, and topical creams, sprays, and patches when caring for pain or symptoms that we have. They're great tools for us to use in the acute phase for us to get over our injury and be able to function in day-to-day life, but it's important that we don't become dependent on them, because that could lead to accelerated wear and tear down the road by not listening to our body when it's trying to tell us something. Thank you for watching. I'm Dr. Taylor Pascal. I hope you got something out of the video. If you did, give it a like, give the channel a subscribe. We're going to continue to put out great content just for you. Hope to connect with you soon. Take care.